Medical necessity is a term you hear and see all the time in healthcare. What is it? Welcome. I am the Medical Bill Whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to empower patients like you. Medical necessity is basically a battle between two different perspectives. And yes, there is a referee. Let's start with the medical point of view. This is what your doctor has deemed are the necessary, appropriate, indicated, responsible steps that she or he must undertake now so that the diagnosis that has just been established can be dealt with. If you were to consult another physician under the same circumstances, the same steps would have been undertaken. It is following the medical standard of care, and on that topic I have a special in-depth video. In a nutshell, if your doctor believes that is the best, most effective care that can be prescribed at this time and that you require in order to regain your health, that is medical necessity. Now, the insurance company's point of view may sometimes differ. It goes by what is called a medical policy. That is a document that has established guidelines for coverage of many prescription drugs, treatment plans, surgical interventions, and more. It determines whether something is experimental or investigational, if your diagnosis or the circumstances do not match the requirement listed under that policy. This is what the Utilization Management Department will refer to when reviewing an authorization request, or an appeals department's reviewer when giving a decision on an appeal. It is a benefit coverage roadmap, if you will. If you follow the instructions on it, and if your condition meets all the criteria, then chances are it will be covered. The medical policies are usually based on medical evidence, professional guidelines, effectiveness data, best practices, and more. However, what is not always made clear is that medical policies can also refer to more cost-effective methods, conventional and traditional paths, least invasive or least aggressive methods in order to get to a result which your doctor may have ruled out as being not as effective or more debilitating, hence having chosen maybe a more innovative, targeted, and yes, expensive option. If an authorization or your claim is denied as not medically necessary, you can appeal. An appeal is a request for your insurance to review the case and potentially overturn a denial decision. And for that, you can use the third point of view, that of the experts. The main ones are the federal health agencies, the FDA, the CDC, National Institute of Health, to name a few. WebMD, the National Cancer Institute, can also become sources of documentation on what constitutes medical necessity. The National Library of Medicine is also a treasure trove of documentation. Trial results, data from specific disease organizations, reports, recommendations from professional medical organizations, including the AMA, American Medical Associations, can also help you find documentation and evidence to support medical necessity. And don't forget peer-reviewed articles and literature published in medical journals, drugs or devices manufacturers' reports, data in compendia are also good sources of information. And last but never least, CMS, Center for Medicare Medicaid Centers. If Medicare covers it for the condition and under the same circumstances as yours, then commercial insurance plans should too. So you may have to prove medical necessity not just based on what your doctor orders, but on what the U.S. medical profession and health agencies have declared to be medical necessity, and even prove that a medical policy on file with your insurance is outdated or obsolete. And in that case, all that evidence, documentation, plus your medical records will bring you a bit closer to getting approved. I so thank you for watching. Do like, comment, or subscribe if you find the content of these videos helpful to you. This channel sure can use them to grow and reach out to more patients. So thank you.